Welcome back, everyone, to the Deep Dive. Today we're going to be looking at botulism, and specifically we're going to be targeting this towards medical microbiologists.
Okay.
So the idea is that you already know all the the basics of botulism,
Right.
and we're going to try to extract some of the more surprising or lesser known facts
That's good.
from our sources, which today are Microbiology, the CDC, and a little curveball,
Oh,
Microbe Canvas.
interesting.
So let's dive right in.
Okay.
Botulism is caused by a toxin produced by Clostridium botulinum,
Yes.
and sometimes C. bactericum, C. baradii, but primarily botulinum.
Right.
And this toxin is one of the most potent toxins that are known.
It's it's remarkable how potent it is.
Yeah, 1 gram could theoretically kill 1 million people.
Yeah. It's a scary thought.
And it's interesting because botulism is actually relatively rare.
Yes, that's the truth.
So you don't see it that often, but when you do, it's pretty impactful.
Absolutely.
Have you ever encountered a case of botulism?
I have actually, early in my career, I dealt with a case of foodborne botulism.
Oh, wow.
Yeah. And it was pretty frightening to see how quickly it can progress.
Yeah, it really underscores the need for rapid diagnosis and treatment.
Absolutely.
So there's these types of botulism that we all know, foodborne wound infant,
Right.
but then there's this adult intestinal toxemia, which is
Kind of a mystery.
Yeah.
We don't fully understand it.
it's very rare, and we don't know exactly what causes it. Some people think it could be related to underlying gut conditions,
Possibly. Yeah.
but it's really a puzzle.
It is.
Now, I know you've dealt with the more common forms.
Yes.
Have you ever seen any of these rarer types of botulism?
Not personally.
What do you think the challenges are in diagnosing and treating these rarer forms?
Well, from what I've read, I think the main challenge is differentiating it from other neurological conditions.
Makes sense.
And also making sure you get the right antitoxin, because there are different types of botulism,
Right.
and each one needs a specific antitoxin.
Right. So getting that initial diagnosis, it's really important.
Yes.
So something that might be relevant to your work is that botulism is showing up more and more in the context of drug use,
Oh, really?
particularly black tar heroin.
Interesting.
So there's an increased risk of wound botulism among people who inject drugs.
I see.
And specifically, the injection method matters.
Okay.
So injecting drugs under the skin, which they call skin popping,
Right.
or into the muscle, which they call muscling,
I've heard that term.
that increases the risk compared to just straight 5e injection.
Makes sense.
Have you seen any changes in wound botulism prevalence in your area?
You know, it's hard to say for sure without hard data,
Yeah.
but anecdotally, it does seem like there are more cases related to drug use.
And what prevention strategies do you think are most effective for this population?
I think education and harm reduction are key.
Right.
Needle exchange programs, safe injection sites, things like that can make a big difference.
Yeah, absolutely. So let's take a little trip back in time now. The word botulism actually comes from the Latin word botulus,
Oh,
which means sausage.
interesting.
And that's because early outbreaks were often traced back to contaminated meat.
Ah, I see.
There are even descriptions of botulism dating all the way back to 1793 in Germany.
Wow.
It makes you think about how our understanding and treatment has evolved since then.
Yeah, I mean, back then they must have been completely baffled by this disease.
I know, right? They had no idea what they were dealing with.
It's amazing how far we've come.
It really is. So there is a botulism vaccine,
There is.
but its usefulness is a little bit unclear.
Right, because of the potential side effects.
Exactly. It can have some pretty serious adverse effects.
Yes, as of 2013, research was underway to develop a safer and more effective vaccine.
What do you think are the biggest obstacles in developing a better vaccine?
Well, I think the main challenge is finding that balance between effectiveness and minimizing side effects.
Makes sense.
Ideally, we want a vaccine that's easy to administer, provides long-lasting immunity, and is safe for a wide range of people.
So what happens when someone gets botulism? How do we treat them?
The standard treatment involves botulism antitoxin and supportive care.
So it's a two-pronged approach.
Exactly.
Can you talk more about that supportive care?
Well, supportive care is really critical because botulism can cause paralysis,
Right.
which can affect the respiratory muscles and lead to respiratory failure.
It's scary.
So patients often need to be on a ventilator for weeks or even months.
Wow.
And the recovery process is gradual.
Yeah.
As new neuromuscular connections form, the paralysis slowly improves, but it takes time.
So let's talk a little bit more about the antitoxin itself. How does it work?
Sure. So it's essentially passive immunization using a horse-derived antitoxin.
Okay.
This antitoxin binds to the circulating toxin and prevents it from doing further damage.
So it's like giving the body a temporary immune boost.
Exactly.
And are there different types of antitoxin?
Yes. The most common one is a trivalent antitoxin, which targets types A, B, and E. But there's also a heptavalent version that was approved in 2013, which targets more types.
Interesting. What are your thoughts on the pros and cons of each type?
Well, the trivalent has been around for a while, and it's generally effective against the most common types.
Right.
The heptavalent provides broader coverage,
Yeah.
which can be helpful when you don't know the specific type or if there's a mixed infection.
So it's like having extra insurance.
Exactly.
But I imagine in your experience, both types can be effective.
Yes, as long as they're given early enough.
Right. That early intervention is key.
Absolutely.
So let's talk prognosis now. What's the outlook for someone with botulism?
Well, the paralysis can last for quite a while, usually 2 to 8 weeks.
Oh, wow.
And during that time, they often need intensive care and ventilation.
It sounds like a pretty intense course of treatment.
It can be. The fatality rate with treatment is about 5 to 10%.
Okay.
But without treatment, it jumps to a staggering 40 to 50%.
Wow, that's a huge difference.
It is. It really underscores the importance of prompt medical care.
Absolutely.
Yeah.
It's worth noting, though, that infant botulism generally has a good prognosis.
Yes.
Less than 1% fatality.
For hospitalized infants, that is. But there can be complications associated with the treatment itself.
So even with a positive outlook, there are still potential challenges.
Yes, that's true.
So my last question for you is, what do you think are the biggest unanswered questions in botulism research?
That's a good question.
What are the knowledge gaps that, if filled, could really advance prevention, diagnosis, or treatment?
Well, one area that I find particularly fascinating is the role of the gut microbiome in adult intestinal toxemia.
Oh, yeah?
You know, if we could figure out how certain gut conditions contribute to the growth and toxin production of Clostridium botulinum, that could revolutionize how we identify people at risk and potentially even prevent botulism.
That's like a whole new frontier.
It is. Imagine being able to manipulate the gut microbiome to prevent this disease.
It's an amazing thought.
It is. It just goes to show how much we still have to learn about the complex interactions between our bodies and the microbes that live within us.
I agree. It's a really exciting area of research.
Absolutely.
Well, we've covered a lot of ground today.
We have.
From the potential of the gut microbiome
Right.
to the complexities of diagnosis and treatment.
And the evolving landscape of antitoxins.
It's been a fascinating journey into the world of botulism.
It really has.
And to our listener out there,
Yes.
if you're on the front lines battling botulism in the lab or the clinic, we commend your efforts and we encourage you to keep pushing the boundaries of knowledge.
Absolutely. Your work is vital.
And your insights and experiences are invaluable to the ongoing fight against this potentially devastating illness.
We're all in this together.
Science is a collaborative effort.
It is.
And by sharing our knowledge, we can make real progress in combating botulism.
I completely agree.
Well, we hope this deep dive has provided you with some new insights and perhaps even sparked some ideas for future research or clinical practice.
Me too.
Until next time, keep exploring, keep learning, and keep diving deep into the fascinating world of microbes.
Stay curious.
And we'll see you next time on The Deep Dive.
Bye.